Let's talk about fevers in children. Fevers are really scary for parents to deal with, especially new parents with young children. Fever is the body's normal response to inflammation or infection. And the definition of fever is 100.4 taken rectally. A lot of people are scared about taking rectal temperatures in babies. They don't care at all. You can totally do it. It doesn't bother them one bit. With older children, if they'd be more comfortable with a temporal scanner or an ear thermometer, that's totally fine. However, you don't need to know the temperature, and we'll talk about that in a second. The body temperature normally varies in everybody, every day, sickness and in health. So that means in the morning, when you wake up, that's typically when the body temperature is the lowest. And in the evening, the body temperature starts to raise. And that number can be 99, 99.5, 100. The number that really corresponds to infection or inflammation going on is 100.4 or higher. The only time it's really important to know if it's what the number of the temperature is when there's an infant less than 6 weeks of age. Because 100.4 or higher in a child that age could really be signs of a serious infection, and that warrants a phone call to the doctor right away. In children older than 6 weeks, you can really use a variety of other measures to determine whether your child is ill and needs the doctor right away or whether it can wait until the morning. You want to make sure that the baby is feeding properly, that the baby's color is good, that the activity level is normal, the baby's not lethargic. If all those things are normal and you just feel that the baby is warm, you can wait until the next day to see the doctor. If it's an older infant or a younger child, you can wait a couple of days if fever is the only symptom that you're seeing. Things that happen normally in the body with fever are increased heart rate, and increased breathing rate, and headache, all those things that you can see or your child can complain to you about. They're all normal responses to fever. You don't have to treat a fever if the baby or child is otherwise comfortable. If they feel hot to touch, but you see everything else is normal, leave them alone. However, if they are hot to touch and they are complaining of severe pain, being very uncomfortable, then of course you want to give them fever medication to bring that temperature down. Let's discuss fever medication. There are two main groups of medications that we use to take fevers down in children. One of them is acetaminophen. The common known brand is Tylenol. It comes in a preparation of 160 milligrams per teaspoon. The way that it's dosed is about 1 teaspoon for every 22 pounds of body weight. So if you have a 22-pound child, that's 1 teaspoon every 4 hours. Acetaminophen is very easy on the stomach, which means it can be given if you have a fever that goes together with the stomach virus. It's also available in a suppository form over the counter. Ibuprofen is a fever reducer and an anti-inflammatory, so it actually works a little bit better for the higher fevers. It lasts about 6 to 8 hours, so almost twice as long as the acetaminophen preparations. And conveniently, it's dosed the same way, about 1 teaspoon for every 22 pounds of body weight. It's a little bit harder on the stomach, so I don't recommend the use of ibuprofen when there is any stomach upset. The common brands that go with ibuprofen are Children's Motrin and Children's Advil. One of the things that really panics parents about fever is the possibility of febrile seizures. And I want to reassure you that febrile seizures are very uncommon, and they happen really more with a rapid change in body temperature rather than a number of temperature. So people often want to know, is there a temperature that's too high, that's too scary, that I can't just leave alone? And the answer is probably not. Again, we're not really checking their temperatures anymore because we know hot is hot and it doesn't really matter what the number is unless it's a young infant under the age of 6 weeks. However, if the temperature rapidly changes, there is a possibility that your child can have a febrile seizure, and we'll discuss that in a future video. In the meantime, if you have any additional questions about fever management in children, please feel free to email me at askdrrisa@gmail.com or follow the link below to get to our website.